In this video, I'll try to address the differences between Biden and Sanders on healthcare. So Biden's proposal for dealing with healthcare is basically tinkering around the edges. He proposes to simply extend the Affordable Health Care Act to the entire population as an alternative option to private insurance. He's also proposing to limit self-participation to 8.5% of the insured's income. His plan leaves in place the private healthcare industry, which is likely to elbow out the public plan by offering healthcare providers a better deal, a better price, if they choose to offer services to privately insured versus the publicly insured. Private healthcare insurers normally pay 2 to 3 times the amount Medicare pays for the same services at current time. The private insurers are not concerned about the overall price paid by them, simply because they pass that cost onto the consumer in some way or another, while securing their own healthy profits. So it is you, the insured, that is actually bearing those higher negotiated prices. If public healthcare plan intends to bring prices down, it could cause a second tier or a two-tier system, as is the case with Medicare, with medical assistance programs today, where the choice of providers and the quality offered is much lower for those insured under the alternative plan. This would cause, of course, have a severe impact on the overall likelihoods for success of the healthcare plan in the long term. Well, further, it does nothing to address the cost of healthcare or coverage of medication, mental care, eye care, dental care. Neither does it anything to limit deductions, coverage ceilings, or eliminate the copays. Those are basically known to be suppressing the seeking of proper preventative or even acute medical treatment by lower income earners until the conditions have gotten severe and critical. In contrast, Sanders' plan is expanding Medicare for All, a program that's already working and working well, and replacing the private insurance companies entirely. Those insurance companies basically have added a margin of many billions of dollars on top of cost of the medical services themselves. It's an overhead that's completely unneeded. Medicare for All cuts that overhead right out of the system and would at the same time also seriously lower the medical costs paid to the providers. For this reason, Sanders' plan would not only lower the overall government spending on healthcare, but also the individuals. Medicare for All saves money, not wastes it. All this while providing full basic health care for all, including medical health, mental health, that is, eye care, dental care, and pharmaceuticals. Because Biden's plan has no leverage on pricing, it is bound to be extremely costly if it is to supplement the expenses over 8.5% to everyone. Ironically, Biden's plan is, in fact, the more costly solutions between the two. That's right. The Biden plan would be more costly, not less costly than the Sanders plan. In fact, Sanders' plan saves money as opposed to Biden's plan. If you're under the illusion that Biden's plan stands a better chance of passing Congress than Sanders' plan, which is a common argument made by centrists, you are highly mistaken. Republicans are dead set against ACA or Obamacare, as they named it, let alone Biden's expansion of it, and would fight it just as hard. We might as well get a wider population of stakeholders involved in fighting harder for a better, more inclusive plan, rather than putting out a milquetoast solution that does not address the core issues and the overall price increases.